everyone, I'm Himani from Baby Moo. I am the co-founder and I'm so glad to have this live video with all of you joining in. We are having a very special conversation with Dr. Vidya, and she is, I'm gonna introduce her very soon, but she is a phenomenal, renowned gynecologist, infertility specialist, a surgeon, and she is someone that you can go to with your eyes shut because she will take care of you. All your questions about pregnancy, about childbirth, about infertility will be addressed today. So please go ahead and put all of those in the question box. I'm just waiting for a few more people to join in since we lost out on a few of them because of the technical issues. But I'm so glad that we are having this conversation finally, because we wanted as a brand to reach out to parents and address all of their worries, all of their concerns, and I'm really happy that we are getting to do this with her because she's very, very busy. She's just delivered a baby, which is amazing news as always, and I'm just gonna see if she can join in now. Hi Dhruvi, hi Mirang, hi Dr.
Hi,
Vidya, so
sorry for
good
the
to
glitch.
see
Yeah.
you. Hope you've
Yes,
had a great
I
day.
had a little caught up day
No problem.
and so the
It's so good
delay,
to
but
see
I think I'm ready for the question answer session.
you. Yeah, can you tell us a little bit about yourself
Uh,
as well, and how you
okay,
can
so
help the
I
moms
am
out here
a
and dads,
practicing
of course.
gynecologist and an obstetrician, and I have a special keen interest in infertility. So having been a part of
Okay.
the obstetric career in my life, I've met several hundreds of young moms and have dealt with certain high risk pregnancies and been able to help them out. Uh, in my practice of
Hmm.
fertility, I've been able to manage getting women, having problems getting pregnant and dealing with all those conditions. So I think with an experience of almost good 20 years plus,
That's
uh,
great.
it's been a good journey for me. And today
Yeah.
I'm all set to, answer the women who really have problems and they want somebody to kind of give them an understanding of what they really want to know. So I'm all ready, all yours.
Thank you. Thank you so much for being here with Baby Moo, and thank you so much for being with the
Yeah,
Baby
Baby
Moo
Moo is
family.
very close to me.
And I
So
think we should just jump
I said, Baby Moo is very close to me.
right. Yes, I think there's a slight
No
lag, so
problem.
just bear with me. Um, so yes, I'm just going to introduce myself. I'm Himani. I'm the co-founder of Baby Moo, and my partner Vinita Jain is, of course, your
Yes.
very, very good friend. And I'm so glad that Baby Moo has completed a year, and we've had such an amazing response of products. We have products in every category, from nursery, feeding, bathing, diapers, apparel, accessories, like you name it, we have it. And that's what, like, our aim was, to kind of give a mother or father every single thing that they would need at their fingertips, and they don't need to go anywhere, especially. Um, So a couple of questions that we got. I'll start off with infertility. Someone asked us if they've been trying to get pregnant for a few years and they don't know what they're doing wrong. What could be the possible things that could be an issue?
Uh, so, uh,
Do put in all your questions in the question box, because it might be hard to read the comments. So I would request all of you to put in your questions in the question box. Thank you everyone for joining. Hi Avni, hi Ruchika. Um, I think I think Dr. Vidya was having an issue with the internet. I'm just gonna ask her to
Can you hear
rejoin.
me? Hi.
Hi,
Hi, Himani.
we can hear you.
Can you hear me?
Yes, we can hear you. Yes, we can.
Yeah. So you wanted to ask me about
Yes,
fertility issues in the young women, right? I think, with
yes,
today's
yes.
the generation that we are meeting, we're all meeting women who are in the working era, where there's a lot of stress, long hours of work, traveling. So we are meeting couples who have, time issues, where they are in shifts, they are in medias, and not really able to, be together. And we have to realize that a woman is fertile only for a day. So if she releases her egg, it's going to be there for 24 hours to maximum about 30 hours. And that is the time when the sperms have to be around. So if you intimate with your partner,
Right.
even 2 days before or 2 days after your fertility day, you will still not get your pregnancy. So it's very important, and that is where we are having issues of compliant with this kind of phase. Yes, timing.
Timing is
Plus, there's a
key.
lot of stress, as I told you, like so when you are stressed out, there are a lot of hormonal imbalances that happens in your body. So, in all, we are seeing a lot of
Right.
such issues. But again, there's a rise in male fertility issues too that we have noticed. So, I wouldn't, when I look at a couple, I say that you both are 50% partner in having a baby. So, of course, it's always,
Yeah,
we equally want
of
the
course,
male partner also
absolutely.
to be examined, and they maximum have to do one test, which is a analysis of the semen, which gives us the sperm parameters, and that's all for a male. Unless we find certain problems, we don't
Hmm.
ask them to have any further tests. But for a female, yes, we look at a complete profile of the woman, which means a basic test of an having her hormonal profile. Yeah. Did I?
Right, I think we lost you for a bit, but we got the gist of what you were saying. So, guys, put in all your questions in the question box. I'm gonna start with infertility issues, followed by pregnancy, and followed by what to do after childbirth. So, put in all your questions, and then we take them one by one. Hi, Ibrahim. Thank you, Vrishti, for the compliment. And we are facing an issue. Just a moment.
Yeah. Got me again? I'm so sorry about the glitch
Yeah, we
here. I
got
don't know
you.
why today it's all behaving weird.
That's
Yeah.
fine. No problem. So, how many rounds of IVF does the average Indian couple
Yeah.
go through?
Sorry, Himani, can you get back to the question? Hello?
How many rounds
Yeah.
of IVF? How many rounds of IVF? First of all, I would love it if you could explain a little bit about IVF. And how many rounds of IVF does the average
Yeah.
Indian
So
couple go through?
basically, IVF is an invasive kind of a procedure where it's called in vitro fertilization, which means that we do not allow the woman to release her egg within her body, but we get it out. So we aspirate it. Now, initially, we work up the patient, and IVF is never the first choice given to any couple. We always start with a basic protocol, which means we help in the couple tracking the eggs and then allowing them a timed relation. So much happens that in timed relation,
Hmm.
we have really noticed that the men go through a lot of stress and they're not able to perform. So this becomes more mechanical to the couples. The second option is when we don't get results in the basic profile, we step up the protocol and we go for an IUI procedure, which means intrauterine insemination, where we kind of mimic the natural act. But here, what we do is we process the men's semen and get the best quality sperms in, and we directly insert it in.
I hope you guys can hear me as well. Please just let me know in the comments if you can hear me. I think we were good so far, but having a little issue with the internet at Dr. Vidya's end. But I hope you guys will stay tuned because we have a lot of great questions that are going to be answered. Just give me a moment. So guys, please put in all your questions in the question box. Please let us know if any of this is informative. If you have any specific questions, please put them in. I'm just gonna check if Dr. Vidya can join us again. So Dr. Vidya was talking about the different forms of getting pregnant and the different fertility issues and different methods in which you can get pregnant. So don't worry, I'm going to address your questions again. Just put
Hi,
them all
Himani,
in the
I'm back.
question box.
Oh, I'm so
Hi,
sorry
good
about
to
this
have you
glitch. Yeah.
back.
Okay, so what did you hear about my protocol? Was I audible enough to
You were talking about
insemination? So,
insemination.
as I said, insemination is a process where we ask the male partner to give his sample in the clinic itself, and we process it, and we then load it in a small tube, flexible tube, which goes through the womb directly, and we place the sperms as close to the tubal opening in the cavity of the uterus, and it's done in as an outdoor procedure. It takes about good 5 minutes. Then we ask the woman to just lie down for a while. Now this procedure needs us to look into the tubes, whether the tubes are open or not. We cannot blindly just do the procedure, and this procedure can be done 6 times. If a woman has to get pregnant, she would definitely do in the first 3 cycles. Maximum is 6 cycles. If a woman does not get pregnant in 6 cycles, that's when we step up and counsel the couple that it's time we look into the IVF protocol. Now, again, IVF protocol can be looked in earlier also if both the tubes are blocked. If both the tubes are blocked, we cannot do any IUI procedure,
Right.
because the sperms are meet the egg. So the logistics will not work. In this case, the IVF comes up. Again, in IVF, we need to know the age of the woman. Very, very important
Right.
aspect, because age is the criteria for IVF. The younger the woman, the better her chances to get pregnant. If the woman is elderly, we have certain tests to understand her ovarian reserve. And then we counsel, of course. Now, in this process, we always ask the woman to meet us on day 2 of her cycle, and we give her the hormones that she has in her, but they are of, they are little on the lower side. So we give the same hormones externally from outside. Of course, we monitor her eggs, the size of the
Right.
egg, and as soon as we get the size that is ready to rupture, we trigger her, and we ask her to come exactly 36 hours later. Under anesthesia, we put in the ultrasound probe, look at the eggs, and we aspirate each and every egg that is accessible through the ultrasound. So what we do is at the same time, we ask the male partner to give his sample. They are taken together. They are fertilized outside. The grading of the eggs are done. Once the fertilization happens, the grading of the embryo is done, and the best quality embryo is then reinserted into the womb. So we kind of mimic the pregnancy. You know, the implantation process, we do it artificially, which otherwise naturally happens.
Right.
I think that's
Right. And how,
I would
what is,
say I would
what
yeah.
is
So
the
the percentage
percentage of,
is anywhere between 25 to 40%. Again, as I said, that age of a woman is a big criteria, and of course all other status, and the number of
yeah. So one of the questions that we have is, what is the risk factors for someone who is obese?
oh yes, the risk factor for obese is there's no risk factor, but remember that the quality of egg is always compromised in obesity. Which means that we are looking at a condition called PCOS, where obesity is one of the marker, you know. So when we look at PCOS, we're looking at stubborn ovaries, ovaries that do not ovulate on their own, and we need to. So obesity is one of the criteria where we ask the patient to actually drop the process of the fertility and tell them concentrate on your weight loss program, because maybe while doing that she will naturally get pregnant. So weight loss is our first criteria, but of course
Right.
if the age is good, 35 plus, and we don't really have too much time, her reserve is coming poor, then of course we don't really wait. But what we could do is we could ask her to freeze her egg, you know, so that she can go on with her weight loss program. We could get her eggs, and we could always freeze her eggs or her embryo and then do the needful. Obesity has a lot of it's a
Right.
kind of a session that I can take, because it can have lot of side effects and repercussions of being obese. So my take on, and who on whoever is planning to get pregnant, if your BMI is high, if it's more than 25, please concentrate on a lifestyle modification. That is the treatment for you.
I think getting
In
fit is
any, and
always
fit in the right
key for
way. Yeah, fit in the right way
anything in
without
life.
stressing much, because stress again
Right.
is a cause of fertility issues.
So a lot of questions, because most women are now working. What is the time till when they can work through their pregnancy,
So there is no
ideally?
time limit for work. In fact, there is no book that says that a pregnant woman cannot work. I think pregnant women should work. They should keep themselves busy, but of course, looking at their pregnancy condition. If they have certain issues with their pregnancy, for example, if a woman is having a pregnancy induced hypertension, I think she should know and respect her body demands. If her body is not allowing her,
We
yeah,
can hear
can you
you.
hear me now, Himani? Yeah. So if
Yes.
a pregnant woman is doing well
Yes.
and all her parameters are fine, she can work till the end of her pregnancy, which means a beginning of her labor also. So there is no such criteria that says that don't
Wow,
work.
that's
In fact,
amazing.
I would definitely encourage women to be busy, but of course, everything half the speed. Do not rush to, you know, get into a bus. Do not rush to get into a rickshaw. Do not rush to, you know, so avoid having a fall, avoid running behind the uh, things and stressing too much.
I think we should jump into a few of the
Yeah.
pregnancy questions. So I'm just gonna give you a few. One is, what supplements should a woman take, and what should the diet
I
be
think
like?
supplement wise, for an Indian woman, most of them are usually anemic to begin their pregnancy. So normally after the third month, it's the first 3 months we look at folic acid to be given. 400 microgram is what the daily dose should be. And all our Indian markets have the folic acid. So first 3 months, concentrate on that. Usually the first 3 months, women cannot really have good nutrition because of the nausea and vomiting that they experience. So I just tell them to go light, eat what suits you. So you stick to vegetables, you stick to fruits, avoid anything heavy, spicy, oily, fried items. But in the second part, after the third month, which means after the 12th or 13th week, when your nausea and vomiting settle down, that's when you must look at having a balanced diet, which means it includes carbohydrates, proteins, and fat in their normal this. So I don't think you need to change your diet. You eat what you were really eating, but concentrate on a good protein supplement, iron-rich food. So as I said, we Indians are always anemic.
And how much protein should they?
So
How
I
much
think as
protein
an
should they
Indian
take?
diet, we all have dal, all pulses and all that. So I think just go with that. Plus
Right,
we supplement them
right.
with some protein powders and milk to be taken. I think that is good enough. You don't really need to go on a high protein diet. Just balance yourself. If you have an egg white
Right.
every day is also good enough. So there is no diet that says go on a high protein diet. You just balance your diet with the carbohydrates and the fat and the vitamins that you require. A good calcium supplement is what we Indians believe in giving. 1,000 milligram is what we look at.
So something that's
Absolutely,
just well
absolutely. I
balanced.
always tell my patient a poor man's diet is the best diet. You know, roti, sabji, dal, chawal, and all this, they make a good diet. And that's why you see the labor class women, they really have
Right,
healthy baby and they go with their pregnancy so well because they don't stress on that. They go with the flow of the pregnancy.
right.
Always,
Less stress,
always.
the better. Yeah. So one of the questions that we have is spotting normal
So spotting is really
during
not
pregnancy?
normal, of course, depending on the condition. So when a woman is in her first 3 months, spotting can be it can be disastrous because you probably have had a missed miscarriage, which means that the pregnancy is not going in the right direction, and that's why you're spotting. The second one is threatened miscarriage, which means that something is not really going well, and this woman needs to kind of take some more progesterone to support her pregnancy, or she needs to take rest if she's really worked out in her day to day activity. And sometimes it could be a condition of the cervix, that is the neck of the womb, where there could be a small infection or an erosion. But anybody who has spotting or any kind of bleeding should always meet her obstetrician, should have a scan so that we know everything is going fine.
Right. And what is it that like a lot of them are having trouble sleeping?
So,
So how do you
as I
sleep
said, in the
when you're
first three
pregnant?
to 4 months, there is no real position. You can sleep what position you always like to or love to sleep. But after the fifth month, when the pregnant uterus is a good size, almost coming to your navel, that's where we uh, tell them, Hima.
Sorry, could you go
Yeah.
back to the last
So,
bit?
women after the 20th week, usually the pregnant uterus can compress the blood vessels which are just behind them, and that can compromise the flow to the baby. So, we normally don't allow patient to sleep on her back. We ask her to sleep on her right or left lateral position. Always, if some women cannot really take the lateral position, we ask them to keep a soft pillow between their thighs, and that will be the right position. So never sleep on your back completely after the fifth month. And if you want to sleep, try and give a little tilt by placing a pillow just midway. Half the spine is covered with a soft pillow so that there is a tilt of 15 degree, which will not allow the compression of the blood vessels.
You explained that
I
beautifully. Um, I have another question here, which is how do you deal with morning
Okay, so
sickness?
morning sickness is, I always tell patients, those who are homemakers, no offense to them, they always have more time to think. And that's when you feel more nauseous, when you think, oh, I'm pregnant, I can't do this. So don't do that. Um, Try and distract yourself. Keep doing something. That's when you don't really feel too nauseous. But if you're carrying a twin pregnancy or more numbers, yes, the hormones, the pregnancy hormone is much more, and you may have a lot of feeling of nausea and throwing up. What you could do is try and be light, eat small meals more number of times, eat what makes you feel good. People can, pregnant women can have aversions to certain foods. They may not be able to take smell and all. These are all fine because it's all individualistic. So respect what you feel like and eat small meals. There are certain medications that we can give. There are certain conditions where a woman can have hyperemesis, which means she's not really able to tolerate and she really throws up whatever she takes in. Such patients, of course, we need to treat them with intravenous injections and all that, but the rest can be managed with their own, ways of eating and taking care of their day-to-day activities.
And what should be the ideal gap between
A
two
good interval
pregnancies?
of 2 years is what we look. The reason being that when you have a delivery, you lose a lot of blood. It's a natural process, whether you have a natural birth or you have a belly birth, as I always say. Uh, so to get back that hemoglobin level, to get back the calcium that you lose while feeding the baby for a year, you need to get back to that level. So you must give 2 years to have a healthy pregnancy between your two pregnancies.
Great. So I hope you guys got that. You need 2 years at least between two pregnancies. And I think with COVID and postpartum depression is common, and a lot of moms are finding it difficult to go back to their old selves. So, what advice
Himani,
do
I
you
just
have on
missed
that?
that question. Can you just rephrase it to me?
I was saying if you could help mothers with
Okay, yeah,
postpartum depression
yeah,
and
yeah, yeah. So
postpartum hair loss and
yeah, yeah.
all the
So
issues which
Himani,
come with
you
postpartum,
really asked the right
and what
question.
is
I think a
normal.
lot of women who are watching really want to know this because we in India don't really bother about mental health of women. You know, you deliver and the whole attention is on the baby. The mother is always sidetracked. So women have to
Right,
know what suits them
right.
best. And depression is a part of postpartum. You could even go to psychosis at times if you are not taken care of. Okay, a woman here who starts with depression is definitely going to go into depression. So as a physician, I must know that. I must know her history, her past history, whether she's ever had depression or she's going through any kind of stress. We need to address that very clearly to her. So, what you said, Himani, is always a good communication between the doctor and the patient is very important. A good support from the family, especially the partner, is very, very important.
Correct.
So, if we realize a woman is going through depression, counseling her and communicating with her is very important. In fact, I normally, when I meet my patients post delivery, this is one thing I speak to them in front of their partner, or if the partner is not there, then we speak to the family who's around and let them know that if she is showing any signs of depression, please bring it to our notice, speak to her. I even ask the patient that if you the early
And what are
signs
the early
is
signs?
the things are why the depression happens is suddenly she's not able to get good night's sleep. She's just been up the whole night. She's had a bad or a good delivery, it depends. She's had a belly delivery, then she has a lot of pain, and also all this can, so trying to the baby. These are all signs that we need to pick up,
Yeah,
where she is not showing any interest in the baby. There are times when psychotic mothers can just take the baby and harm the baby. So these are signs, but these signs are normally seen in women who've already gone through depression and the family knows about it. So they have to take. Now, whenever they see such things, just connect to us. We probably ask them to meet some counselor. We have a lot of counselors who help in postpartum, depressions now. You don't need to give them medications as such. Just counseling them can do wonders. Of course, some of them may need some anxiolytic, and you need to be very careful because they are feeding mothers. You just can't give them any kind of medication. You need to really, really know whether this patient needs it or not. So, mental health postpartum is very,
Right.
very important.
Could you explain childbirth and um,
So,
what is it that you need to
Himani,
do just before? What is it
if
that
you
you
tell
need to
me
do just after?
childbirth is a very, very natural uh, process. We all women should know that as soon as we complete 9 months, not necessary 9 months, some patients can have preterm. So we have 37 weeks as a term. So once a baby completes 37 weeks, we know that this baby can come out and independently function without the need of being, you know, connected to the mother through the umbilical cord. Okay, so the first thing when a baby arrives out is we
Right.
disconnect it. You We give the clamping and cutting of the cord,
Right.
and that's when the baby is independent. The first cry is what is important because all the fluids that's in the lungs are all out with the first cry. So these are very important.
Right.
Labor, of course, there is early labor, active, latent phase and active phase. So in the latent phase, the patient usually is quite comfortable. But as soon as she gets into the active phase, her contractions can last much longer, and the intervals between two contractions can be very, very small. Now, this is the time when the pains can be really, really bad, and women usually lose their cool. But today, by the introduction of epidural, we can give women painless delivery where she can, even move in the pain and she will not realize that. But you also need to know that the last part of labor where she gets all the pressure onto her perineum and the back passage, that's when the head is almost down there compressing. Now that is the time nobody would want to give an epidural dose. We call it the top up dose. We avoid it because we want the patient to feel the pressure, and that pressure will make her push. You pull on her thighs, you separate
Right.
it, and you ask the patient to take a deep breath and push down. And that's where we actually see the baby coming out. We call it crowning, where the baby's head tries to come out.
Right.
In India, we don't believe in not giving an episiotomy. An episiotomy is giving a small cut so that you don't have a tear in the perineum, and you allow the baby to come out and not really injure the perineal muscles. So natural birth is beautiful, and the patient can, be mobile as soon as she delivers. Okay, but if things don't go right, which can happen, like
Right.
I always tell my patients, previously women delivered because they were so active, they would squat, work, and do a lot of activity, eat less, no junk food, and that's why the size of the babies also were less, and they could come out.
Yeah.
But today we are getting a lot of big babies, hodgy podgy babies, 3.5 kg plus, and we all like big babies. And that's where the passage is not enough for the passenger to come out. And these are the reasons that leads to, a belly birth rather than telling you a C-section.
Right. Right. And what is the ratio now of and you know between a normal delivery and a belly birth?
A normal delivery is anything that is vaginally, so a natural birth happening, whereas a belly delivery is a C-section. Of course, both the birth is equally the where
No, I mean, what is the what is the ratio of so another question that we had is when is a good time to start?
Himani.
Can you Yes, I can hear you. Yeah.
Can you hear me now, Himani?
Hi. I hope you can I can hear you.
Hello?
Let us know in the comments if you can hear us.
Yeah, can you hear me now?
Hi, I can hear you.
Okay. Yeah, you were asking me
Yes.
something.
So we had a question about Kegel exercises and does it help and
Okay.
when is
So
it a
so
good
so
time to
Kegels
start
is
with
never
them?
given while you are carrying a pregnancy. Kegels exercise is usually given postpartum to women who had a vaginal delivery, wherein the baby is large. You needed to use an instrument to deliver the baby, and she's kind of, had a major tear and all that. And we know that there is going to be a laxity in her perineal muscles. That's when we ask her to contract her perineal muscles. Basically, it is a squeeze that we ask her to do. Hold the squeeze for a count of 8 and then relax. So you squeeze, hold for a count of 8 and you relax. Now, this has to be done at least 8 times. We ask the patient to do it 3 times a day, 8 times in the morning, 8 times in the afternoon, 8 times in the night. You can do it lying down, you can do it walking, you can do sitting, you can do the squeeze anywhere you want. But this will help you to tone up your perineal muscles, and it retains the tone to kind of pre-pregnant state. Of course, it will never be the same like before, but very close to. So if you do it diligently and in a right way, yes, you can preserve your tone and may not have any kind of uterine prolapses that we see. And I think it should be done minimally for at least minimum 3 months. I can't hear you, Himani. I can't hear you. I can't hear you. No, I can't hear you. No, I can't hear you. Yeah, I can hear you now.
Right.
Yeah,
So
sorry.
can you hear me now? Right. No problem. I wanted to ask you another question that we got from a lot of uh, mothers and fathers is that what are the products that you must have before pregnancy?
What are the products? I would say, what are the medications a woman should do have before she's pregnant? So one is, before you plan a pregnancy, you must start with folic acid. It plays a much larger role for the baby's brain development and the spine. So you must go on folic acid, which is, as I said, 400 microgram. If you see it on the branded ingredient, it should be 1 milligram of L-methylfolate. Start it 3 months before you're pregnant. Try and have a relaxing job. For today's women who are already stressed out, I would say that a good job, try and be on your best health, in the sense, as you said, in the beginning, we spoke about obesity. Obesity can have a lot of repercussions in
Okay.
other way. So I would say be in the best form of your health. And if you are in a best form of health, I'm sure you will do well. Products,
What kind of exercise would you
a pregnant
suggest
woman.
for um,
Yeah.
women in
So I
the
always ask
yeah,
the patient that, have you been an exercise kind of a person? Because not all have, been exercising and all that. So walking is the best form of exercise. Swimming is
correct.
very good. But of course, again, public swimming pools may not be good, and it will be a detrimental effect on the patient. So I normally tell them to do good walking, relaxed walking, not really brisk walking and all that. If you have been a exercise person, squatting is a good form of for your hips. A flexibility to the hip bone, because while we
Right.
deliver, we actually are in an inclined squatting position. So we must do those exercises. Yoga is a good form to relax yourself completely. So a basic exercise, you need not do a lot of, and good breathing exercise. You must realize that when you go into labor, you must learn to control your pains. A good deep, inhalation, exhalation can help you uh, distract your pain also. So nothing too much about it. People today have a lot of things, I must join an ANC class and all that. But basically, I tell them to join the ANC class is when you meet people, it's a nice, you talk about healthy things, good diet. So it's nice. But if you don't know an exercise and you're trying something new, do not try that, because that could probably create a problem with your ligaments, because you must realize that when you are pregnant, all your ligaments are loosened up. The whole idea is to accommodate the baby in your stomach. So it's going to, stretch, it's going to shift certain organs and create a problem. So you must take it easy.
That is great advice. I wanted to ask you another question that we've gotten, and everyone, please feel free to leave in your questions in the comments and in the comments box. And I think we've got a lot of compliments for you. All your uh, patients have been rooting for you in the comments. Um, so one question is that uh, are cloth diapers good for the baby?
So I think we should not forget that our ancestors only used cloth diapers and not this. So it's absolutely fine. It's only that, when the cloth is wet for a long
Right.
time, it could just irritate the skin. So I normally tell patients you can use anything. And always remember that if the cloth is wet, if a baby urinates, the cloth is wet, she or he is not going to feel comfortable. So they become cranky babies. And of course, in the rainy season, how many of the diapers, you wash and clean, and the detergents you use all can cause irritants. So sometimes, yes, in the new generation that we meet,
Right.
I would still tell them that a diaper would be more comfortable. One, it absorbs all the, urine, and keeps the baby feeling dry. So the baby can also have a good night's sleep, and so does the mama. So a cloth is not a bad idea, but try and keep the baby open for some time. Don't always keep the baby closed,
Right.
because the wetness can cause a lot of irritant to the baby.
Until what age is swaddling right?
There is nothing like an age, I always believe that everybody has an individualistic idea. Today, in a place like India, you have, if a woman, there are 10 people to advise you, so you should do what you think is good for
Correct.
you, respect your demand, respect your body,
Is
and do what suits you the best.
So just
Absolutely.
take it as it comes
Absolutely.
and just
Always,
go with
always
your
go
gut
with your gut
feeling.
feeling. But if your gut feeling is not right, speak to your doctor. Don't Google up, and don't read all the, as today, one of the patient actually came and told me, I Googled that this happened. I said, the Google is going to give you all the information. You cannot pick the right information because you really don't know about it. Just come, speak to us. We are here to tell you that.
Right. Right. I want to thank you for your time. I want to also ask you to give us some of the questions that I may have missed that most couples ask you,
Well, I must, yeah.
and something that's really important information that we might have missed
I
out.
think, well, with Baby Moo, more to the would-be moms, my only advice to all the mothers is just be yourself. Enjoy your pregnancy. Pregnancy is not a disease. Just take it the way it is natural. You know, you don't need to worry about what you wear, what you eat, what you do, and all that. Just do everything what suits you best. And please do not share your stories, unwanted stories, and all that, and get information that's not really needed for you, because that fear can then build up, and that can end up in a very bad way, as you very rightly said, depression. Yes, because this is the fear of everything, fear of going into labor, fear of having abnormality in the baby's fear, because these days in Google, friends talking, you hear a lot of such things, because social media can be good as well as bad. So look at the good part of pregnancy, enjoy it,
Yeah.
do everything in moderation. So if you want to have some junk food, have it, not an issue, but moderate. You can't have, I had one patient who actually came to me and said, oh, I really get good kicks in the night, doctor. And I said, wow, that's great. And I said, what do you really do in the night? Do you have something sweet? She said, yeah, I just have a Cadbury every night. I said, don't do that. Your baby is only going to gain weight, you know. So you know what? Eat right food, healthy food. It has to be balanced food. Once in a while, you can cheat, but just go with the flow. Enjoy your pregnancy. That's all. My advice is don't make pregnancy feel like a disease. Just enjoy it. And for all the couples who have fertility problems, half of the time we are pressurized. One is by our own family members who really don't know what trouble. No couple wants to differ or deter from being pregnant. They have certain conditions, but as a couple, you need to believe in yourself. You need to support your partner, and don't make her or him feel bad. Go to the right person. There are enough fertility specialists who can help you with basic changes in your ways and get you what you want. If things don't work up from the basic protocol, we do a lot of step up, but use the technology wherever is required. Don't say that, oh, this doctor, I tried 4, 5 months, kuch hua nahi, let's go to another doctor. Don't have multiple visits. Don't do multiple doctors. Have faith in one, because getting pregnancy is as important for the doctor treating you as much as you wanting a pregnancy. And we cannot step up the treatment as soon as we meet you. We need time. We need your trust in us. So take it easy, have patience, because this is something that I don't see in nowadays generation. They don't have patience. They are so anxious about everything. Don't be anxious. Just
What is the time? What is the age at which you want to ideally meet a woman latest? Which is the latest age when you
for
want to
what?
meet a
For
woman
pregnancy and help her out. Yeah,
and
I
help
I
her
would
out
say
with her
the peak
pregnancy?
pregnancy fertility period is between 25 to 35. So for all the women who are working, for all the who want to delay their pregnancy, try not to go beyond 35. It's not that you will not get pregnant. Of course, it. I don't want to put the women who are not married at 35 to think that they will not be pregnant ever. No, you can get pregnant even up to the age of 39. But as I said, the reserve of the ovary can go down. In some, it goes really fast, whereas in some, even at the age of 42, they can get pregnant without needing any assistance. So it's individualistic. But of course, the majority of the women post 37, 38 can have problems in getting pregnant. So they should try and meet us before they hit the late 30s. I would say before 36, 37, you must try and meet us.
And where can they
They
find
can
you?
just Google me at Touch of Joy Women's Clinic and Fertility Center, and they invest.
And you
I
are
am in
in
Mumbai.
Mumbai,
I am in Mumbai.
right? So thank you so much, Dr. Vidya, for your time.
I
Thank you
I
for this all the amazing
I
advice that
enjoyed the
you've shared.
session.
I think
Yeah,
all
and I
our
must thank
viewers,
you, Himani. Thank you so much.
yeah,
I must thank
I
Vinita Jain who gave me this opportunity. I'm so sorry. I have never been live on a Insta platform, so it was a little problematic. It was a little glitch from my side to get connected. But
that's
yeah, I
that's
think
not an issue. I think where technology is constantly
yeah,
changing and we need to
I am
adapt,
getting
so it's
advanced now.
fine.
Thank you to you and your partner, Vinita. And if anybody wants
Yes.
to,
And hopefully we look forward to having
absolutely,
another one
any
soon.
topic that
Um,
comes to
and if
anybody's
there are any
mind, you can always.
questions,
I'm open. I love giving advice. I like counseling people because I think that's where we are lacking now. We really don't give time to our patients, and I feel that's so important to have a doctor patient relationship. So if anybody has any issues, they
absolutely,
can always find me on
absolutely,
Insta. I am in the Insta, and you can just write to me, and
right.
I'll be, if I'm busy, I may not be, but if I do get your questions, I will post my answer. I may,
Yeah, you can leave all your questions in the Baby Moo post, which has gone up, and
yeah,
hopefully Dr.
yeah.
Vidya can
Himani and
answer
Vinita
them.
can do the needful. I wish you all the luck, Himani.
All right, thank you,
I've
everyone.
actually seen all your
Thank you.
products. I have kind of, given the gift hampers to my new arrivals, and they've all been very happy. So congratulations and all
So
the
good
very
to know.
best. Yeah.
Thank you. Yes,
Thank you.
thank you so much. So everyone, please do log on to babymoo.in for all the products that you need for your newborn. And for any questions that you have, always reach out to Dr.
I
Vidya. She is here
I
to
would
help
say,
you out
Himani,
with
reach out
whatever
to all your
concerns that you
nearest
have.
obstetricians who can be of great help. But if there is anything more where you couldn't
Yes,
get this, I'm always there.
thank you. Thank you, ma'am.
Best wishes to all of
All
them
right,
who are
we'll end this live now.
online with us. Thank you. Bye.
Thank you. Bye.